At any rate, there's a bill that passed the Senate yesterday that's going to hopefully address this problem. It was sponsored by the man on the other end of our line. He is the Republican senator from the 8th District in Shelby Township, none other than Pete Lucido, joining us this morning. How are you, Senator?
Good morning, Frank, and thank you. I'm doing great. I hope you are, and bless your heart because of the need to protect the ones that can't speak for themselves, stand for themselves, and sometimes we need a little tender, loving care for the greatest generation that ever lived.
Oh, indeed, and the fact that we sort of backed off of our emphasis on senior care centers, where the people who were really most liable to get COVID, who are most at risk, that's where they reside, and we were doing things here in the state of Michigan that had a lot of folks scratching their heads because we were trying to set up hubs for patients who had been treated for COVID before, and I just had a lot of concerns when I saw all that. How about you?
Same to me, Frank. I had my father in a nursing home and trying to get better for about 2 months, and after he did get better, we took him home. So I had a chance to visually see how the care workers, which are great workers, and the nursing facilities are doing the best they can under the conditions they can. But when the COVID came along, the question is whether or not this was the best practice or whether this met the standard of care in the medical. I had Dr. Cope come up and testify before the Health Policy Committee, and she said there is nothing in the medical journals, there's nothing that is accepted practice that says that this is the best practice to take care of seniors. Bringing a COVID diseased or virus patient into a healthy setting, these are compromised immune syndromes that most of these individuals have because of their age and their organs. You're putting them at a serious risk, and there's nothing that supports any data or medical journals that says that this is the best practice. To the contrary, the governor was very vocal about saying she's following practices of the CDC. My daughter worked at the CDC, and I said, honey, is there such a standard that the governor is relying on that you know of? There's no standard that says anything about this, and I challenge her to bring that forward and show the citizens of this state, as her constituents, what is the data that supports this behavior, or what is the medical journals say at the CDC for these standards.
Well, that's been one of the frustrations, hasn't it? That she keeps talking about her data, but she never cites it. She keeps saying all of my information. This is all based on science and data, and then she never tells us what that science and data is.
Frank, on March 13th, prior to her executive order to have COVID patients join non-COVID patients in a nursing home, the HCAM, they're called, Health Association of Michigan, those are the ones that take care of the nursing facilities. They said to the governor in the memo's published, everybody's got a copy now, says that we don't believe it's in the best practice to do this. We believe to have our facilities that are not yet licensed, which means have somebody from LARA come out, licensing division, inspect it, and we'll put COVID patients there, and we'll separate them from. And it's in their memo. And she, after 6 weeks, turned her back on them and said, we're going to do it this way. Now, what I want to know is what doctors did she consult with? And the Robert Gordon, the director of MDHHS, which is Michigan Department of Health and Human Services.
By the way, I understand he is not a doctor, by the way.
No, he is not. And Frank, you know what? He's a lawyer, and I asked him at a hearing on the oversight, why don't you explain to the citizens of Michigan what doctors you relied on to give you guidance in guiding the governor in her order to say if a facility is 80% or less occupied, they must. It must means they have to take COVID patients so long as they keep the patients separate. Well, separate means a sheet with a clothesline like Mom used to have at home when she needed 2 separate rooms, and that's not what the fire department or the fire marshal said. Or the people that inspect from LARA, they said, no, that's not what we were talking about. So the policies were being breached. 6 weeks go by and people are dying of age. Why didn't they get a committee together and said, hey, we better study this. There's something wrong here, and change courses like New York did and like all the other states? We're the last state that's still doing this nonsense.
I saw a story this morning that indicates that we may be on the verge of a resurgence in cases here in Michigan. It looked like they were
Hmm.
going down, but I saw a story that said they might be going back up. What are you hearing in Lansing?
Yeah, we hear the same thing. The numbers are going up, but again, I can't even rely on the data. I'm very disappointed, and I'm very frustrated. In fact, when you don't get the data to the people that need it most, the legislators, to make decisions, you're really being made decisions in the dark. But not this time. This bill that was passed yesterday in the Senate says, real simply, if you're living in a housing facility of nursing care, we understand that that's your house, that's where you live, that's where you have your belongings. But if they don't have a separate facility within there to protect you and to protect others, then you're going to have to leave for a few days to take care of you. But if they do have a separate facility, if they do have it completely separate, then you can stay there. But we're not going to allow other patients to come into the facility with COVID and stack the deck against the odds on those that can die.
Well, that's good to hear because those are the most vulnerable, the elderly who have pre-existing conditions, and if we can protect them a little bit more by not introducing them to the virus in the first place, that would be great. Especially when we get word that we may be seeing a spike right now after we had seen the number of cases going down here in the state of Michigan. Are you getting any information from the governor's office on that or from the health department?
No. In fact, Frank, when you ask for things around here, we're waiting on 6 weeks now from Robert Gordon, the director of DHHS, and I said, "Where's your death rate numbers? The federal government are giving us them. Why don't you have them when you're supposed to report on a daily basis from these healthcare facilities?" He said, "We're working on it." Well, you know what? People that used to work in my law firm that said they were working on it, they were working somewhere else.
Yeah, I hear you. That's not getting it done, is it? And especially when you
No.
got a public health risk like this, we need action immediately. Hey, thanks for
And we
being
need
with
to,
us. Congrats on getting this bill through. And
thanks.
these are tough times, and we've got to take the issues, I suppose, one by one. There's not a one size fits all solution, and so you keep attacking these problems as they pop up, and that's a
Hey,
good thing. Yeah,
one last thing, Frank, before we say goodbye.
yeah.
You know, if I had a loved one in a nursing facility and I can't get access to my loved one and they can't come out and see me because those are the rules that the governor set in place, the frustration level is beyond anybody's imagination with families that I've sat and talked with. So I want to say a prayer for all of those families out there that they be given some peace, and the person that they love most, that's the most vulnerable, let the Lord shine some light on them because they are the ones that we are here to protect.
Amen. Thanks for joining us, Senator. We'll talk again real soon. You be well, okay?
Great to be with you, and have a great weekend.